Here at WellSpan, we have a program addressing hip and knee arthritis. It's known as our Total Joint Program. It's a pretty comprehensive type of program. It's not just going to see the doctor and off you go to surgery. It integrates other allied professionals as well. One of the things that I think is very pivotal in preparing patients for surgery is being able to see and meet the physical therapist before surgery. They go through a very thorough evaluation, identifying the needs that the patient may eventually have after surgery. And then lastly, there's a sort of an integrated process that evaluates the x-rays, evaluates different aspects of the patient's physical exam to try to identify what is the best operation for a particular person. And all of those things sort of come together to be able to form the best plan, have the best, most efficient surgical intervention, and expedite the patient's trip back home so that they can recover in their own familiar environment.